thanks. Now we're back here with a heart. This is a large bovine or cow heart that is brought in, and it's actually a very good size match for the model we were talking about earlier. So sometimes, again, when you have it, it's discolored because it's been, sitting outside of the body for a long time and has some preservatives in it, so it doesn't match the same colors. But I think you can appreciate the similarities here between both of these structures. So to just try to draw in the similarities, this is the left ventricle here, and it corresponds over here to the left ventricle. This groove here, this sulcus that carries the anterior descending artery, this is the anterior descending artery here, and that corresponds to the anterior descending artery here. Now the anterior descending artery runs right through the heart, and that septum, that wall that separates those two chambers, this runs right over that. And so you can actually say that this is the right ventricle, and this is the left ventricle, because this artery separates those. And the one thing you can appreciate here is there's a lot of fat on this organ. Everybody does have fat. When people come into the operating room for the first time, they're always surprised by the amount of fat, and they always ask whether everybody has that much fat. People have varying degrees of fat around their heart. These cow hearts frequently have a lot more fat because of the way they're raised. They're raised to grow up fast and big, and also to have fat because the taste of beef tends to be better when you have some fat within the beef itself. And so as a result, they tend to get exuberant amount of fat around the heart, but all hearts do have some. So again, this is comparison, the left ventricle and the right ventricle. And then when you come over here, this area here, this is called the right atrial appendage or right auricle. Now auricle stands for, it's like an ear or a dog ear, and here is the equivalent on this structure right here. So this auricle or right atrial appendage corresponds to that right atrial appendage. And then over here you have the left atrial appendage, and that's what this corresponds to right here. This is the left atrial appendage right here on this cow heart. So this tissue right here is the left atrial appendage. It's part of the left atrium as well, but it's the appendage. It's this little ear of tissue which is reflected here. And so these arteries right here would be right under here, and they would run right in that groove right there. And if you took a scalpel blade and dissected down there, you would actually see those arteries that are actually running right inside that groove right there. And when we get up to these big vessels here, so this big blood vessel here, the pulmonary artery, is right here where my finger is. It's not blue, obviously, because it's not illustrated, but my finger is going straight in to where this vessel would be here. The aorta is cut a little short here, but my finger is going inside of the aorta, which is cut off at about this level on this tissue. Notably, cow hearts tend to divide off very early, and so they have a branch that comes off very early. So the cow heart, you can see this is all part of the aorta, but that's one of the differences between that and a human heart. But this is basically still, you would call this the aorta, and this is this branch coming off on us right up here, the innominate, but essentially they all communicate right here. My fingers are touching. So this would be where the aorta is. Now, when we come over here and we want to look at the atria, remember I've described, the superior vena cava and the inferior vena cava. Here is where they are on this heart, or on the back side of it. So if I tried to make it just like we have it pictured there, the inferior vena cava is very thin tissue down here, and my fingers are actually touching right here. And I actually brought in a straw, and it's not the easiest because it bends so easy, but you can actually see with this straw that they do actually touch and communicate, because we're going to try to get it to go all the way through here. Maybe this way might be a little easier. There we go. and you can appreciate that basically these communicate to the inferior and superior vena cava. So this here now, you can appreciate, is the superior vena cava right up here, and the inferior vena cava down here, as I said, and the liver would sit right about here, runs right through here. And then here is the back wall of this atrium here. And as I said, see these two branches right here? You can appreciate those two branches here. I put my finger in one of those holes, and I put my finger in the other one of those holes. And then over here, on the other side, they cut it so short that this one hole represents both. The branches came out here, but where they cut it, and both of these, now my finger's going right into the left atrium. So, and my fingers here actually communicate. You can see it goes all the way through because I'm putting my finger the equivalent of through here and out there. So that's sort of the equivalent of where they are. Now let's go back and trace the those arterial anatomy. As I said, the actual arteries come off right through here, and there's an artery that comes off of this aorta and travels in that groove. Now this one has so much fat around it that it's hard to see, but this is actually that groove right here called the sulcus, and that's where that artery is coming off. So if you had a blockage in that artery, we'd dissect down to it, and if the blockage were here, we'd dissect beyond it, open up the artery, and then construct a bypass graft into that. But it actually travels in that groove right there, and you can see it over here traveling in that groove right here. The other artery comes out here, out the front, and as I said, it comes out the front right here, and it comes out right underneath his ear. Remember we pointed that ear earlier? Here's that ear here. So it travels right in front of that ear, and then it's coming up and giving off this branch right here. If you trace it, that's that branch going there. And then this branch right here is coming up right underneath that ear of tissue. Here's that ear of tissue. It's coming up and it's traveling right in this little sulcus here, and it's traveling right around here, and it's giving off all of these branches right here. Now the one thing you can see on this model, these branches, is that all of these branches, and you can see it here, they give off branches, and all these branches head in one direction towards the apex of the heart. Even the ones coming off here give off branches, and they're all headed towards the apex. And that's actually a very good thing, because oftentimes and frequently what we'll see in patients or people that come in, they may slowly develop a blockage in one of these arteries. And as that blockage develops very slowly, then the branches of it, which come off of it here, and say this branch here comes up and gives this branch here, it comes up here, and then it can communicate with this branch here, and then ultimately this branch here can pump blood backwards into this vessel here, if this one, so we call that collateral flow. And oftentimes it can help people sustain a lot of heart function, so that if just because this vessel slowly gets blocked off, this heart muscle doesn't have to completely die because it gets blood supply backwards through that vessel. So now let's go ahead and try to cut this heart. It's always hard to sometimes get it exactly in the plane because it depends on how thick the heart muscle is, but we're just going to take a regular knife here to begin with and see if we can get it so that we can cut it sort of right through the apex, and see if we can get this. I want to get it cut through the table, and they're always a little harder and stiffer when they're in this, but here we go. And we don't want to cut the hands, so let me try to get through that.
Pretty thick.
Yeah, it's very thick.